Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5. We are at 6, so it'll be 5 minutes. If we go over 10, it'll be 3. Vendors, suppliers, and other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation to bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on this or discuss any or negotiate any claims at this meeting. Thank you. Can I get a motion to adopt the agenda as the order of the day? Thank you. All in favor, say aye. Any opposed? Motion passes. Thank you. Can I get an approval of the minutes of the meeting on September 25th, 2025?
So moved.
Thank you. And a second. Okay. All in favor, say aye.
Aye.
Any opposed? Motion passes. Next, there's no board report. So next up, I'm David Verinder.
Thank you, Madam Chair. I am happy to get to introduce our board and our community to 2 of our Excel Award winners today. The first being from September, and I'd ask David Moon to come up and join me. David? So, David is our Excel Award winner for September. He's with Central Distribution Lead. He is a Central Distribution Lead in Supply Chain Operations. David has been an employee since 2020, is described by his colleagues as collaborative, forward-thinking, and analytical team player who is invaluable to the department and health system. Coworkers also say David has excellent communication and follow-up skills and always remains highly professional in every situation. He takes the initiative to resolve problems and find solutions and proactively works hard to prevent supply shortages, helping to ensure our specialty teams always have what they need. David goes above and beyond to help others and took the time to develop a very effective process for SMH to receive and distribute food bags from the All Faiths Food Bank to patients in need. He knew the benefits it would bring and was determined to make sure everybody was involved. As one admiring colleague said, David is truly the best. So David, thank you for everything you do for our community, our hospital, and our patients here. Thank you very much.
I want to say thank you. It's a great honor to be a part of my team and the bigger hospital system.
Well, thank you very much.
David.
Congratulations. So I'm also honored to be able to introduce you to our Excel Award winner for October, Danielle Schwab. Danielle. Here, come step closer to me. All right. Danielle, who is a physical therapist and advanced rehab specialist on our PT outpatient team on the Sarasota campus. Danielle joined at SMH in 2017, is described as a natural leader and motivator. The positive outcomes she achieves with patients, despite the severity and wide range of their diagnosis, are nothing short of remarkable. Her excellent communication skills and innovative approach help patients exceed their goals beyond their expectations. Danielle also is skilled at identifying opportunities for improvement and working collaboratively to improve patient outcomes. For instance, she jumped in to help develop workflow to support disease-specific programs. Danielle is patient, kind, and above all, has a heart of gold. She makes each patient and peer feel like they're the most important person. Danielle, thank you so much for everything you do for our community, our patients, and our patients, community, and everybody else.
Yeah.
All right.
really grateful to my team for nominating me for this and also to the organization taking a chance on me as a new graduate. And so I've been here for a long time and I've had great opportunity for growth. And so I'm grateful for that. So thank you.
Thank you.
Yeah, thank you.
Congratulations.
Thank you, David. Next up is our medical staff reports. First is Dr. Kaplan. Didn't know if he was coming.
Good afternoon. Today I'm asking for a motion to approve the SMH Sarasota 2025-2026 Medical Executive Committee roster, including the medical staff officers and department chairs as recommended by the SMH Sarasota Medical Executive Committee.
So moved.
Can I get a second?
Second.
All in favor, say aye.
Aye.
Any opposed? Okay, motion passes. Thank you so much. Next up is Dr. Murphy.
Hi, thank you. Good afternoon, everybody. Today, I am also asking for a motion to approve the SMH Venice 2025-2026 Medical Executive Committee roster, including the medical staff officers and department chairs as recommended by the SMH Venice Medical Executive Committee.
So moved.
Can I get a second? Okay, all in favor, say aye.
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 Any opposed? Motion passes. Great. Thank you so much to you both. Next up is our secretary's report from Patty Mariah. Take your time.
Okay. SMH board calendar, December 2025. This is two. How do you get rid of that? Good? Okay. December, I have to put my glasses on. Tuesday, December 16th, 2025. It's the third Tuesday due to Christmas the following week. From 9 to 9:30 is a closed session hospital board meeting, and from 9:30 to 11 is a finance committee meeting. And that's it.
Thank you so much. Appreciate it. Does anybody have any questions for Patty? Okay, hearing none. Next up is our treasurer's report, Kevin Cooper.
Thank you, Madam Chair. Only one item under my report, which is the approval of bad debts and charity care. And with that, I would look for a motion to approve the bad debts and charity care for the month ended September 30, 2025 in the amount of $40,554,000. And for the month ended October 31, 2025 in the amount of $31,308,000.
Thank you. Can I get, thank you. All in favor, say aye.
Aye.
Any opposed? Motion passes. Next up is Jen Rosati for our financial report.
Good afternoon. This afternoon, I'll be presenting the financial results for the month of October 2025. Since this is the first month of the fiscal year, the numbers will be reflective of month to date and year to date. You won't see two separate sets. Total revenue for the month of October, our actual results, $188,462,000 versus a budget of $178,959,000. Our total expenses for October for the month, actual $173,591,000 versus a budget of $173,078,000. Our operating income results for October, our actual results, $14,871,000, resulting in an operating margin of 7.9%, and the operating margin excluding our EPIC costs of 8.4%, versus a budget of $5,881,000, which would have resulted in an operating margin of 3.3%, and our operating margin excluding EPIC of 5.9%. Our statistical results for the month, our average daily occupancy, our actuals were 905, which included an average acute length of stay of 4.26 versus a budget of 923 and an average acute length of stay of 3.45. Our total admissions and observation cases for the month were 7,358 versus a budget of 7,159. Continuing with our statistics, our surgical cases for the month were 3,183 versus a budget of 2,567. Our births were 429 versus a budget of 391. Outpatient registrations for the month totaled 53,357 versus a budget of 51,938. And our emergency care registrations were 15,763 versus a budget of 16,194. Our case mix index for the month for Sarasota CMI all was 2.01. For Sarasota CMI for our Medicare patients, 2.18. For Venice, our CMI all was 1.44. And for Venice, our Medicare CMI was 1.47. And that concludes my report.
Thank you so much, Jen. Does anybody have any questions for her? Okay, hearing none. Thank you. We'll move on to the committee reports. Today we met with our governance committee, and since I am the chair of that, I'm going to pass the gavel on to Sharon as I read my report. The Governance Effectiveness Committee met earlier this morning. After approving the agenda and the minutes of our last meeting, we had presentation by David Verinder with the 2025 fiscal year highlights for the healthcare system. That presentation was followed by the CEO compensation review with Jessica Vahey of Willis Towers Watson, providing valuable information and insights to the committee. The committee conversed regarding the CEO's compensation, and recommendation was made by the governance committee to increase the CEO's base compensation by 10.3% and increase the CEO's maximum annual incentive by an additional 10% or 10 basis points, consistent with the board's compensation philosophy. At this time, I would like to move that the board approve the new executive compensation based off our leadership performance appraisal policy and the governance committee's recommendation.
Second.
So moved, and we have a second. Is there any discussion? Are we ready for a vote? All those in favor say yes.
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 Any opposed? Hearing none, motion is carried.
Thank you so much. The next item that the governance committee agenda was the fiscal year 2026 SMART plan and the systems goals, which were presented by David Verinder for review by the board. Those were fully reviewed, and we are looking forward to another great year by the healthcare system. We've then reviewed the 2026 board and committee calendar, and now I'd like to move that the board ratify the current 2026 board and committee meeting calendar.
So moved, and we have a second. Any discussion? Are we ready for a vote? All those in favor say yes.
Yes.
Yeah.
Any opposed? Motion carries.
The governance committee also considered the appointment of community members to the committees. Several members of the Sarasota community were interested in participating, and after having considered the applications submitted, made their recommendations. At this time, I move that the following community members be appointed to each respective committee. Richard Bratton to Mission and Planning, William Noonan to Finance Committee, John Patterson to the Investment Committee, Stephen Schwably to the Finance Committee, Janet Stern Solomon to the Investment Committee, and Dr. John Strausser to Mission and Planning.
So moved. May I have a second? Any discussion? We're ready for a vote. All those in favor say yes.
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 Any opposed? Motion carries.
Thank you again. Several members of the board will be attending the Governance Institute Leadership Conference in January 2026 in Naples. At this time, I would like to make a motion that the board approve the reasonable travel expenses for the board members attending this conference, pursuant to the board's policy regarding reasonable travel expenses.
Second.
We have a motion and a second. Any discussion? We're ready for a vote. All those in favor say yes.
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 Any opposed? Motion carries.
Thank you. The governance committee next considered 3 policies that were up for review. At this time, I'd like to make a motion to approve policy 710.bd.01, travel and education, policy 710.bd.02, strategic planning, and policy 710.bd.12, transparency and public reporting.
So moved. May I have a second? Any discussion? All those in favor say yes.
Yes.
Any opposed? Motion carries.
Thank you, Sharon. That concludes my report for the Governance Committee, and I will now reclaim the board chair position. So next, we have the election of the officers. This meeting is always our annual organizational meeting, and we elect the board officers for next year. At this time, I am seeking a motion of election of slate of officers as discussed in the Governance Effective Committee earlier today for the 2025 and 2026 board year. As chair, Kevin Cooper. As first vice chairwoman, Sharon Wexler de Peters. As second vice chairwoman, Patricia Mariah. As secretary, Pam Beitlick. As assistant secretary, Greg Carter. As treasurer, Brad Baker. And as assistant treasurer, Vic Rohe. Can I get a second? All in favor, say aye.
Aye.
Any opposed? Motion carries. Thank you very much. Next on our agenda is the President's Report by David Verinder.
Thank you, Chairman. I am, I'm sorry. As I do each month, go through our organizational report card. Just kind of like Jen Rosati had said, this is our first month of the fiscal year, so the numbers are 1 month and counting, and sometimes projected out. In our organizational card, we had our 5 areas of concentration: service, people, quality, finance, and growth. The first area is service. We have our goal is having our likelihood of recommending in our 10 areas that we survey be greater than or equal to the 75th percentile. Our goal is to be 8 out of 10 of those. Happy to report, and this month we are 10 out of 10, and I will show you the details on that in a minute. In the concentration of people, we have our goal of having our new hire retention, which is our percent of regular full-time and part-time employees hired in FY 2005 that are still employed as of September 30th, be at 83%. Since it's the first month, you might imagine that number is very high. So it's 100% at this point, but more to come on that as the year goes on. In the quality area, our goal is to have our infection prevention, our combined overall standardized infection rate, be at or below 0.8. Just to remind everyone, the national average is 1.0, so we're already starting quite a bit lower than that, and I'm happy to report we are at 0.53. In the area of finance, as you heard from Jen Rosati earlier, our CFO, she reported on our margins. Our goal is to meet our budget at 5%, and I'm happy to report that we're projecting that out right now at 5.7%. And then finally, in the growth area, we have 2 goals: our inpatient admissions and our outpatient registrations. The first being the inpatients at 82, a goal of 82,000. We are projecting higher than that right now at 89,000, and outpatient registrations at 1.224. And we're also projecting higher than that at 1.363. So we did have a busy month this month in the hospital. Looking further at our patient experience report card, these are the 10 areas that we survey as likelihood of recommending. On the far left-hand side, the middle is our score. The next over is the national median, and then finally the 75th percentile. And as I mentioned a minute ago, very happy to report that we are at or greater than the 75th percentile in all 10 areas. So a big congratulations to the staff for their hard work. So last month, Sarasota Memorial marked a century of service with a special reception in our courtyard of our flagship hospital, celebrating 100 years of caring for our community and honoring those who have helped shape our history. Around 200 guests gathered as we reflected on this remarkable milestone and recognized SMH's longest-serving physicians, staff, and volunteers. Among those honored were longtime nurse Carla Rock, who has helped deliver more than 5,000 babies since joining SMH back in 1976. Pulmonologist and critical care specialist Dr. Bruce Fliegler and surgeon Dr. Hesh Coleman, both active physicians for nearly 50 years, and volunteered Jenny Rosenhaus, who has given more than 10,000 hours of service. So thank everyone who came out that day, and thank everyone in our community for helping us celebrate our 100 years. We also got the honor of having our groundbreaking ceremony on November 7th. SMH unveiled plans for the $507 million SMH Northport campus. It will be the city's first acute care hospital and third hospital SMH has built in its 100-year history. When completed in 2028, SMH Northport will be 9 stories tall with an adjacent medical office building. The hospital will initially open with 100 beds, but will include 3 floors of finished shell space, which will allow SMH to quickly double capacity. The campus will have the capacity to increase to more than 400 beds in the future. And once again, thank you for everybody in the community who came out and celebrated with us. Work has also begun on Sarasota Memorial's new rehab pavilion at the Venice campus, bringing our nationally recognized inpatient and outpatient rehabilitation services into South Sarasota County. Locating the pavilion on the Venice Hospital campus will ensure seamless, more convenient transition from the hospital to the new inpatient and outpatient rehab facility. SMH has selected architect Gresham Smith, who has designed the rehab pavilion on SMH's Sarasota campus, and general contractor DeAngelis Diamond to help design and build the facility. Construction is expected to take roughly 2 years, with the pavilion opening for patient care in early 2028. SMH Sarasota's rehab pavilion has consistently been recognized for superior patient outcomes and care by independent rating organizations. Sarasota Memorial Hospital named among Newsweek's best in state hospitals. Sarasota Memorial Hospital was recently named among the nation's leading hospitals in Newsweek's annual best in state hospital rankings. For the 3rd year in a row, SMH Sarasota was the only hospital in Southwest Florida to make the list, ranking number 6 out of 26 Florida hospitals on the 2025 list. Newsweek compiles its annual America's Best in State Hospitals list in collaboration with a global market research and consumer data company. Each state's top hospitals are ranked based on the variety of clinical and quality performance data. This week, Sarasota Memorial marked its 1,000th minimally invasive cardiac surgery. The milestone procedure performed by Dr. Jonathan Hofberger of First Physicians Group repairs or replaces heart valves through a small incision between the ribs. MICS helps to reduce pain, inflection risk, and recovery time. Dr. Hofberger, a board-certified cardiothoracic surgeon, was recently appointed Chief of Cardiac Surgery at SMH, succeeding Dr. Jeff Sell. Sarasota Memorial's cardiac program consistently ranks among the best in the nation, has been nationally recognized for heart attack, heart failure, and cardiac surgery outcomes. So just a really thank you to Dr. Hofberger for everything he's done for this community over the years. Sarasota Memorial recently honored 2 physicians for their exemplary service and announced its 2026 Chiefs of Staff for both the SMH Sarasota and the SMH Venice campuses. Dr. Roger Shea received Sarasota Memorial's 2025 Lifetime Achievement Award in recognition of his 3 decades of dedicated service to SMH and the community. The longtime physician joined the SMH medical staff in 1995 and has served in multiple leadership roles through the years. A pediatric-focused ear, nose, and throat specialist, Dr. Shea has always been widely respected for his compassion, accessibility, and advocacy for children's health. Dr. Elad, I'm sorry, I always forget how to pronounce it, Elad's last name, was named Sarasota Memorial's 2025 Physician of the Year. Since joining SMH in 2023, he has dramatically impacted the lives of so many stroke patients through his neurointerventional surgical skills and collaborative approach to care. He is recognized for his exceptional expertise and commitment to patients and colleagues. And I just want to personally thank both Roger and Elad for everything they've done. Elad is what he does with neurointerventional is just amazing work, and we're very lucky to have him here. Dr. Dan Kaplan was named Chief of Staff for Sarasota Memorial Sarasota Campus's 2,000+ medical staff members and advanced practice providers. And Dr. Dan Murphy, MD, begins the first of his 2-year term as Chief of Staff for SMH Venice Campus, serving as the top representative for the hospital's 1,300+ medical staff members and advanced practice providers. Thank you both for agreeing to do that. Finally, some good news. Sarasota Memorial recently announced that it had reached a new contract agreement that ensures access to affordable, high-quality healthcare for our community. The new contract went into effect October 1st. The new agreement reestablishes and solidifies the relationship between Cigna, Sarasota Memorial, and First Physicians Group. Under the agreement, Cigna Healthcare commercial plan members now have access to Sarasota Memorial's 2 acute care hospitals, comprehensive network of outpatient and urgent care centers, primary and specialty physicians, and affiliated providers employed by First Physicians Group. Patients with Cigna insurance who have questions about their coverage are encouraged to call the number listed on their insurance card. And that is my report, Madam Chair. Happy to answer any questions.
Thank you so much. Does anybody have any questions for David? Okay, hearing none, we will move on to our public comments time. Because we have 7 speakers, comments will be limited to 5 minutes. Commenters are reminded of the rules of civility that you agreed upon when you entered the meeting today. I will not interrupt you as you come to the end of the permitted time, but I will let you know when your time is up. You can also see your time on the allotted screens around the room. With that said, our first speaker will be Jamie LaBarbera, followed by Stephen Gafanti.
Hello, board members, Mr. Verinder, colleagues. I know a lot of you. I know a lot of people in the audience as well. I've taken care of them. I'm a CRNA here at Sarasota Memorial. Before I did my studies in anesthesia, I was an ER nurse and a CV ICU nurse here at Sarasota Memorial. Unfortunately, the reason why I'm here today is to report that working here has been one of the greatest disappointments of my life. It became apparent to me very early on when I started working here as an ER nurse that speaking out was futile. Speaking out about patient safety, even though we sound like we're a wonderful hospital, I was told before I moved here it was one of the best hospitals in the nation. And I found out very soon after that that was not the case. I brought up patient safety issues and they fell on deaf ears. Nurses at the bedside told me, don't even bother. It's not even worth it. It came to right before I was about to graduate from anesthesia school. My father-in-law was admitted at Venice Hospital. He was a patient there, and he ended up having a STEMI at night. And instead of getting any type of American Heart Association treatment, he got mitten restraints and a dose of Haldol. My husband and I came in the morning to find my father-in-law, gray, in bed, holding his mittens up toward me, asking with his eyes, why? Why did this happen? When we inquired what happened, we were told that the nurse practitioner thought that it was demand ischemia and not actually a STEMI. When we go to find in the nurse's notes, actually the intensivist was at the bedside when my father-in-law was having a STEMI. The EKG showed 12-lead critical STEMI alert. She did not call the cardiologist who was already on the case. He had an ejection fraction at admission of 60%, normal ejection fraction. So that intensivist did not call at 4:30 in the afternoon the cardiologist, okay? He did not get any cardiac treatment until the next day. Over 13 hours later, the cardiologist was notified when we found out that morning. He came in horrified. Why did not anybody tell me? So my point is, we went, the kicker was my husband was the nursing supervisor there at that hospital. And he was traumatized. Our whole family was traumatized, okay? When we brought it up to bring this to risk, he asked the charge nurse immediately, bring this to risk. They said they would. My husband went on a medical leave of absence because he couldn't handle being there. When we heard nothing from anybody, he called a couple months later, what's going on with my father's investigation? Risk came back and said, oh, what investigation? Okay. So until we start holding people, negligent doctors, responsible for their behavior, how can we call ourselves great? Okay. This physician got brought on to First Physicians Group. The hospital board brought Sarasota lung pulmonologists on into the group instead of holding her accountable. And I still have to see her here. Okay. So until the pervasive indifference to the well-being of patients and, more importantly, the employees here, because you can get everybody food trucks and food to say thank you, but if you don't care for the actual person, my husband was told his position would be posted if he didn't come back at his 3 months of bereavement time off. He submitted his resignation at that three-month part. So unfortunately, I thought I could stay here and try to make a difference. I love caring for my patients, but I see a lack of human compassion at the bedside. And I see people care more about worrying about their malpractice and getting sued than actually caring about the human in front of them. And in that case, I see my time is almost up. I have submitted my resignation, and I will be working and putting my efforts towards some other place that has higher ethics. Thank you very much for your time.
Thank you, Jamie. Jamie, we do have patient advocacy in here, so if you would like to meet with Brian Peel, he would be happy to sit down with you. Thank you so much. Next up is Stephen Gafanti, followed by Donna Sawyer.
Good afternoon. Medical error is the third leading cause of death in the United States, as you can see from the previous speaker. It is so frequent that every Florida physician must complete medical error training to renew his medical license. Yet at Sarasota Memorial Hospital, covering up deaths caused by medical error appears to be your cultural norm. How do we know? Well, there are 4 nurses on the board, and each one knows that every patient has a legal right to know the name of their treating physician. You have seen documentation showing that this right was explicitly denied to both me and my hospital roommate. The entire board is aware that the hospital's lawyer failed to disclose this violation of patient rights to them. This means the cover-up reached the highest level of the organization. Even the CEO knew that withholding a physician's identity violates Florida patent patient rights laws. On the night in question, the nurses in my room could have allowed me to sign out AMA. Instead, they chose to commit 2 felonies. They acted with confidence because they knew security, the physician, and administration would cover up for them. For the record, I have not been involved in a physical altercation since I was a teenager. Britt Reiner, who led the internal review of my case and 8 others, publicly stated that if the review was not handled cautiously, the hospital could face millions of dollars in liability. This suggests that she considered her fiscal duty to the hospital more important than her duty to the public to ensure safe, quality medical care. A culture of concealment prevents learning. When mistakes are hidden, the staff never corrects them, and the quality of care inevitably declines. The statute of limitations has expired, but the responsibility to learn from the mistakes has not. And this is not merely history. Today, SMH is sending pregnant mothers to Planned Parenthood, which has one of the worst prenatal care records ever. Your obstetrician is still administering an emergency use COVID shot years after the pandemic ended, despite court rulings that it's not a vaccine. The board has an obligation to the community to ensure quality medical care. If medical error is contributing to preventable deaths at this hospital, you must require policies that uphold your standard. Your silence makes the state. You are enabling the cover-up. Given that the board's 4 nurses understand patient rights laws, continued silence risks being viewed as an accessory after the fact. You have a choice. Do nothing and hope that when you or a loved one becomes patients, no mistakes are made, or take action. Demand transparency, initiate an independent investigation, as I have recommended, and restore accountability and improve your patient safety. If the 4 nurses on this board support such action, I am confident Vic Rowe will provide the 5th vote. Thank you.
Thank you, Donna Sawyer, followed by Dr. George Davis.
Just for the record, the name is Cubit Sawyer. It's all one annoying name.
That's okay. I'm sorry. I apologize.
I don't know why. Next time I'm going to be Donna Smith. I'm Donna Cubit Sawyer, and I live in downtown Sarasota. I love many things about Sarasota. I truly do. And I've always felt grateful that we had such a highly reputed hospital. I'm sorry to hear my previous speakers. But anyway, I'm not here to speak about maybe bad things, about the vaccination policies that our state and our country are abolishing and changing. As a preeminent healthcare provider and health research facility in Sarasota County, I urge you to assert your knowledge, your authority, and your resources to educate the public regarding the efficacy and the necessity of vaccines such as polio, measles, whooping cough, and other previous required vaccinations. I haven't had the mumps or the measles. I was lucky. I grew up on a farm in Iowa. I was pretty isolated. And they didn't get that far. They didn't make it past the Mississippi, I guess. And as a child, I was too young to really worry about them. But I remember my parents talking about them and worrying about them. And I remember seeing on TV lines of iron lungs. That did not look fun to me as a kid. And it certainly wouldn't be fun to me now. I don't need to tell you about the high rate of vulnerable populations you have in your service area, and I, as well as my age mates, are one of them. And few things scare me, but these upcoming pandemics do scare me. I hope you will take the leadership in educating Sarasotans through the use of your marquee out there, which I pass a lot, letters to the editor, newspaper articles, public forums, and many other avenues that you have available to you. You are also the leadership for First Physicians Group, which I now am a member of. And by the way, I thank you for honoring Danielle Schwab. I had physical therapy with her for a couple of times. She was terrific. I liked her very much. So good job. And I urge you to have your medical staff of the group initiate conversations with all their patients and clients, regardless of age. I've been told that people born before 1957, and that includes me, may need to have their vaccinations updated. No, in my previous practice, nobody talked to me about them. And then there is Sarasota's share of the 4.7 million Floridians who will probably lose their health care due to the cancellation of the ACA supplement. And how are they to be vaccinated to keep all of us safe? Can you help? I would hope so. Do you have a plan to deal with the outbreaks of once eradicated diseases that our politicians do not take seriously? I take them seriously. And as an individual, I'm helpless to ward off the dangers that I and everyone who lives in Sarasota County are facing in the pretty near future. And we need your help. We didn't know how to prevent COVID, but we know how to prevent what's coming down the pike. This is not, I emphasize, not a political issue. It is a health, safety, life, and death issue. And we need your help. Thank you very much.
Thank you so much. Next up is Dr. George Davis, followed by Lisa Roulette.
Madam Chair and board members, I am Dr. George Davis, a family physician and palliative care consultant. I live in Venice. Today I speak for the Florida Health Professionals for Scientific Integrity. There no longer is herd immunity. There were over 1,000 cases of measles and whooping cough in Florida this year. Those numbers will only increase as vaccination rates have tumbled. These diseases are dangerous with significant long-term side effects, including death. 2 infants died in Texas. These diseases are totally preventable. These vaccines are safe. Measles was gone in all United States in 2000. The low vaccination rates are due to unscientific, misinformed, not medically supported declarations of dangers in vaccines and lies about vaccine medical effects. These lies are coming from federal and state levels of health administration. We must speak up against these medical lies and misinformation. It is too dangerous for our children not to. But doctors' groups, doctor societies are silent. This board is silent. If not doctors or medical boards, then who? I urge you to prepare for the coming epidemics and to speak out against these medical lies and misinformation. Silence aids the falsehoods. Our children need a voice, your voices. Thank you.
Thank you. Lisa Roulette, followed by Sherry Weinstein.
Let Nurse Jamie's courageous comments, highlighting the indifference she says she experienced here as a nurse, be a wake-up call for all of you. All of our board members know that I too have noted the apparent heartless indifference I have also observed when it comes to policy, the failure to protect patients from preventable harm from dangerous federal medical guidance. Sarasota Memorial has invited the CEO of the American College of Obstetricians and Gynecologists, ACOG, to speak at Grand Rounds next month. ACOG has published this appalling recommendation. All clinicians should provide a strong recommendation for updated COVID-19 vaccination to their pregnant and lactating patients. But the Florida Department of Health has recommended against the use of mRNA COVID vaccines for all populations since January 2024. Sarasota Memorial clearly is not acknowledging that mRNA COVID vaccines are dangerous. If you did, you would never be so reckless as to invite the CEO of ACOG to be the keynote speaker at Grand Rounds. I ask our 9 board members, can Sarasota Memorial really be this backward and ignorant in 2025 when it comes to COVID vaccines? What facts do you think the Florida Department of Health is getting wrong in recommending against the vaccines? For board members who have ignored all of the expert analysis community members have provided to you and who have rejected all of my requests for a phone call or a meeting. Do you even care to know? Have you reached out to the Florida Department of Health to get up to speed on this? Or are you just unquestionably drinking the COVID vaccine Kool-Aid, falling for this multi-billion-dollar propaganda hook, line, and sinker? I'm not saying this to be insulting. I'm saying this with truth, conviction, and urgency. If this is the case, it means that the foundation of policy here at Sarasota Memorial is sometimes based on propaganda and not fact. It means that despite all the evidence of vaccine harm that you have in your hands, not enough people here care enough to actually look into the science behind the federal medical guidance you receive so you can discard that which is harmful and incorporate medically justifiable recommendations into Sarasota Memorial policy. COVID vaccines are the Rosetta Stone for understanding that the federal medical guidance you rely on is corrupt. It is corrupt and sometimes horrifically harmful. They are the Rosetta Stone because it is very easy to confirm that mRNA COVID vaccines are dangerous and that patients have been harmed by them. And once you realize that, it allows you to realize that federal medical guidance must be questioned. But the first step is for a majority of board members to care enough to find out the truth. I have a new resource I can try to connect you to if you're interested in finding out the truth about COVID vaccine dangers. He's a former chief of neurosurgery, a retired naval officer, and has been on hospital risk management committees. I think you will find what he has to say very relatable and vital to Sarasota Memorial policy. Until this year, this retired chief of neurosurgery sincerely believed that COVID vaccines were safe, got them himself, and urged others to do so as well. But this year, he did a lot of research and realized that they are not safe. If you talk to him, he'll tell you things like this. They duped me. They got me with their propaganda. It turns out that COVID vaccines are dangerous. The medical profession and patients are being betrayed. And this betrayal is deep and wide. They have removed science from medicine. This isn't science, this is politics and propaganda. That's what he'll likely tell you if you're interested in connecting with him. Let me know if any of you are interested in connecting with him. As the truth keeps coming to light that COVID vaccines and other examples of reckless medical guidance, federal medical guidance, are harmful and patients have been injured, you will not be able to say you didn't know. You will only be able to say you didn't care. You and I both know this. Thank you.
Thank you. Sherry Weinstein, followed by Ruth Brandywine.
Hi there, I'm Dr. Sherry Weinstein, and many of you know me. I've been a member of the Sarasota Memorial Hospital staff for 25 years. I served on various boards, including the QI board, where I was the co-chair for a number of years. I was taken off of that board when I actually started questioning some of the protocols for COVID and some of the things that we were practicing in this hospital. So I have been here as a pro-vaccinator in this community for 30 years. That is until the COVID vaccines came out. And I actually looked at the package insert and saw that it was completely blank. So there was no way for me to adequately consent my patients. There was no way for you to adequately consent the patients that you vaccinated here, including my mother, who died. So in that time, since the past 3 years, I've learned a lot. It's not just the COVID vaccines that are bad, but they're the worst of them all. They have higher mortality rates than all of the other vaccines combined in the vaccine adverse event reporting site. So in the past 3 years, I've started doing much more research, and I gave you all books, vaxxed, unvaxxed, and references. So I please hope that you will read them so you will understand why I became an anti-vaxxer now from a pro-vaxxer. For the past 3 years, I've been following SMH's protocol saying, you know, if you see something, feel something, say something. And man, you guys know I've been at these board meetings for 3 years. As many months as I've been in town, I've spoken out. and there are some questions that still remain unanswered. So I'm getting ready to leave town for a 2 to 3 year medical mission on my medical boat, that's sailing vessel medical leave. So I'm going to be not available to talk and help people here, but I'll be helping people around the world. You can reach me by phone, and I've given you my phone number in the books I've donated. So first of all, the questions I have, and the purpose of these questions is not about blame or politics. It's about transparency, patient safety, and restoring public trust in our medical system. First of all, what change has occurred in total mortality at SMH since the COVID-19 vaccine rollout? Will SMH publish year-by-year mortality data for public review? Number two, has SMH recorded measurable increases since 2021 in cardiovascular events, neuro events, autoimmune diseases, cancer, and psychiatric admissions? Certainly looks like it by the financials up there. We're doing great, man. If we have, so are we doing formal morbidity and mortality reviews? Are we completing these? Financial transparency. There's a hospital, there's a government site called openpayments.cms.gov, and you can look and see who's making what, which hospitals, which providers. And in 2021, Manny Gordia was reported as receiving $1.54 million from Regeneron, which he told me was for research. But yet he goes on the record saying that the COVID vaccines are the safest vaccines ever in history. Where does he get that data? What's he referencing for that? Why have nationally recognized speakers who successfully treated COVID been denied the opportunity to present at grand rounds or in front of the board, while we've got pro-vaxxers and pro-abortionists speaking for grand rounds? That's Sandra Brooks. So to my knowledge, no formal VAERS training was ever provided to SMH clinicians or nurses. Because of no CDC or FDA training exists, and I offered independent materials from the VAERS Project, a nonprofit which helps federal governments to report these requirements, and was told not to circulate them per hospital administration. Right, Dr. Fiorico? Yes. So we need to have accurate reporting. That's a cornerstone of public safety. In our 3-year history, we only had 3 vaccine adverse events reported in 3 years. A hospital of this size should have had 300 to 600 cases reported. The path forward requires transparency in outcomes and funding, openness to diverse medical expertise, and honest evaluation of protocols. Pharma wants you to believe that we're going to have a huge explosion of vaccine preventable illnesses if you don't push the vaccines. That's not true. Recently, shingles vaccine was associated with increased mortality. Influenza pneumonia vaccination increased mortality and hospitalizations. The measles deaths that the gentleman brought up, those were deaths with measles but died from bacteria and hospital-acquired pneumonia. Please make a good decision, because you can make the
Sure,
difference
your
in this
time is up.
community.
Thank you very
and God
much.
bless you.
Ruth Brandywine.
Good afternoon. First, I'd like to start by offering my congratulations to Dr. Huffberger. I was one of his patients not too long ago and received remarkably wonderful care. I'm fine now. And the cardiac unit was terrific. I got very good care, and the cardiac nurses and all of the staff were wonderful. Unfortunately, I then had to come back to the hospital and was in general surgery. And I have to tell you that and my partner also was there several months later. The general surgery floors are very crowded. I know you're a very busy hospital, but the rooms, there's A and B. They're all 2 people in a room. And the A is a tiny little space with a curtain. And then I had to go through the other person's room to get to the bathroom and back. In the middle of the night, something happened, and people came into her room and took her out, woke me up. 2 hours later, they came back. And I understand that. I mean, I'm not blaming anybody, but these kinds of things make it impossible to have a relaxed and helpful recovery. The room was so tiny that only one chair was able to come in. Even I had family coming and they couldn't even get in the room. They couldn't, there was no place to sit. That same thing happened with my partner. He also happened to get room A instead of room B. And it's not really a room. It's just this tiny little space. I think it's a wonderful hospital and I've had very good care. So I'm not being critical of the hospital. But when I see all these huge buildings being built and new buildings and the Northport Hospital and the Fennis Hospital, I'm just wondering if at some point there could be some funds made available to update the general surgery floors so that patients can have a more restful stay when they come to the hospital. Thank you.
Thank you so much. That was the last of our speakers. So having completed our agenda, we are adjourned.
Sarah,
Yes.
or,
Oh,
excuse
sorry.
me,
Yes, go ahead.
Madam Chairman.
Yes.
I just wanted to make an official thank you on behalf of the board members for your service for 2 years as the chair.
Thank you.
We appreciate it. You did a fantastic job leading us.
Happy.
So thank you.
Thank you. I appreciate that, everybody. Okay, meeting adjourned officially.